Hey Deanna, welcome back.
Thank you.
How did things go after your last treatment?
It went very well. I didn't have any bruising. Went well.
Okay, good. Yeah, I mean, as soon as I walked in, one of the things I noticed is you definitely look softer. You know, we've done a few treatments now with
Yes.
Artefill into this mid-face area. You have lost a little bit of volume. You know, the typical way that Artefill works is you get the full effect right away, just like you would with Juvederm or Radius. And then there's a gradual loss of volume over the next month or two as the body gets rid of the bovine collagen and puts your own collagen in place. It's not a one-for-one substitution, so it typically backs off 10, 20, 30, 50%, just depends how much collagen you produce. So what we typically do is we'll retreat those same areas. So for you, that would really be kind of in this cheek area where it's dropped off a little bit. So we'll retreat that, although typically when we retreat, we're using about half the volume or less that compared to what we did during the first or second treatment. The other area that we've treated in the past that we'll touch up today is down here, this area of the in the pre-gel sulcus where these little marionette lines form. And the same thing, just your lower lip is good, but right beneath your lower lip, you've got a little bit of volume loss. And so we'll restore some volume there. And similarly, these vertical lip lines that you have in your upper lip to some degree are related to volume loss. So we'll do a little touch up on the vermilion border to soften those. And very little. You know, a lot of people are like, oh no, don't go near my lips with filler because they have this vision of the overdone lips that people are afraid of, but we're not going to go. We're going to use very little volume there, a tiny amount of filler, and that upper lip area can make a big difference. And finally, the other thing that we're going to do today that we may not have done in the past is you've got a little bit of early jowling here. Not bad, but what we do there is we will actually go all the way back in the area in front of your ear and behind your ear, and we'll put volume there. And what that does is by putting volume here, it pulls back. So we can't put too much volume here, but by getting that backward traction, we actually get some backward traction here, and it helps with the gel.
Great.
This is actually, we call this a Y technique, where we have some filler in front of the ear and in back of the ear, and the combination of those two kind of pulls back. We'll do that on the other side as well.
Doctor, does it make any difference how old you are, how long it lasts?
No, the how old someone is really more determines the amount of collagen you produce. So if we treat someone who's 20, 30 years old, they produce more collagen. So as they get rid of the bovine collagen, they're going to put more of their own collagen in place. So they would probably need less filler to get to full correction. If someone's in their 70s or 80s, they produce less collagen, they would need more treatments because 20% of Artefill is permanent, 80% is bovine collagen, so the bovine collagen is the part that's being recycled.
Okay.
Okay, all right, very good.